So now, without further ado, it is my pleasure to welcome today's first speaker, Ashley Lumpkin, head of Ipsos's Health Insurance Advisory Practice. Ashley, you have the floor.
Thank you so much, and thank you to everyone for attending today. As mentioned, my name is Ashley Lumpkin. I lead our Health Insurance Advisory team. And what that means is I work with digital solution companies and health plans to develop strategic marketing plans and strategic product roadmaps for digital health solutions. And I'm excited to be here with two industry experts. We've got Bettina Hein from Julie and Dr. Kedar with us. I'll allow them to introduce themselves. Bettina, do you want to go first?
Sure. My name is Bettina Hein. I'm the founder and CEO of Julie. I'm a lifelong tech entrepreneur, and my specialty is taking large amounts of data, applying AI to it, optimizing for a certain outcome. I also have a very complex chronic condition, and as my third company, I decided to found Julie, which takes in lots of data and helps people find their triggers and levers for their conditions, and together with their healthcare providers, get better and stay well.
Right. We're so glad you're able to join us today. Dr. Kedar, do you mind introducing yourself?
Yes, hi everybody. Joe Kavita. I'm in Boston at the Mass General Hospital, professor at Harvard Medical School, about 3 decades in the space of digital health. So my portfolio these days includes seeing patients, working closely with the American Telemedicine Association and the AMA on digital reimbursement, editor-in-chief at Nature's digital medicine publication called NPJ Digital Medicine, advisor to a few companies, including Bettina and the folks at Julie. So I'm delighted to join you for this conversation today.
Great. Well, we're excited to have you with us. Thank you so much. So to structure our conversation today, we're going to go over a market landscape quickly. Bettina's going to talk a little more about Julie, and then we'll open up to a Q&A session, a discussion question with both Bettina and Dr. Kedar. I think it's really important, and I'm glad that everyone is here today to talk about this topic. As you'll see in just a moment, this is a really pervasive issue in the American healthcare system, something that really needs to be paid attention to, both in terms of the number of patients dealing with chronic conditions and the healthcare costs associated with chronic conditions. So I think this is a really timely topic, as we definitely are seeing a lot of movement in the digital health space. And I think it's a really important topic too, given just how many people this impacts. So I'm going to start, like I mentioned, with a market landscape, just giving an overview of the state of chronic conditions in the United States. So first, as I mentioned, this is a really pervasive issue, health issue. We're talking about 60% of US adults having a chronic condition, and these chronic conditions accounting for 90% of the US health spend, which is just astronomical. So we're looking at health conditions, chronic conditions, as those conditions that exist for more than a year and require ongoing medical care. And so those folks receiving this ongoing medical care, we're looking at 60% have one condition, and then 40% of US adults have 2 or more chronic conditions. And that's where this multi-condition management that we're going to talk about and focus on today really comes into play, and why it's so important. And then, as I mentioned, the cost is also a factor. We're talking about 90% of the $4.1 trillion healthcare dollars spent in this country being spent on chronic condition management. Was just a huge cost driver for health plans, patients, health systems alike. This is really an area where the healthcare ecosystem is focusing their energies on. And we've called out here just a couple of the chronic conditions that have the highest cost spend: Alzheimer's, diabetes, obesity, oncology, and hypertension, and cardiac issues. And so we really want to be able to talk today about health plans who are bearing the burden of this healthcare costs in this area and are really responsible, financially responsible for this chronic condition management and some of the challenges that they face in trying to work with members to manage their chronic conditions. And so we've identified a couple of different areas where health plans are really running into challenges today. And the first is around expense, right, is that area again. So health plans are responsible for the expenses of our healthcare system, for better or for worse. And so they're definitely feeling the weight of that 90% of $4.1 trillion. The other area is in communications. So health plans are still primarily using mail and phone communications with their members. We know that email penetration among health plan membership is very low. We know that often it requires an opt-in to have an email address for a member, and same for text messages. Text messages are opt-in, and so trying to get members to give you this digital communication information is really challenging. And so the health plans are often forced to rely on mail and phone communications. And this really goes into the next one, which is lack of trust. When we're talking about managing chronic conditions, members want to be talking to their doctors. They want to talk to their healthcare professionals about this. They don't necessarily want to talk to their health plans about their chronic conditions. There's a lot of, I've been doing research with health plans for years, and we hear a lot of, that's my doctor's job, that's not my health insurance company's job. And so how do you overcome this lack of trust? Because you want the patient to be managing their chronic condition, however that looks like. And so how do you overcome this lack of trust is an area that health plans are continually trying to understand and unwrap. A couple of different or other areas that health plans are grappling with is the coordination of care. So again, I go back to that 40% of US adults with 2 or more chronic conditions. That means multiple specialists, multiple labs, imaging, etc. Trying to manage these conditions is a lot of work, and it takes a large care team. And how do you ensure that these care teams are talking to each other, are staying up to date on what one doctor is doing or one physician or one healthcare professional is doing, and making sure that you're looking at the whole person care? And that's really a challenge. And the last 2 challenges I want to talk about, I really see as going hand in hand, and it has to do with closing gaps of care and lack of adherence. And so you're talking about a member who is encountering struggles, whether it be with just busy schedules, being overwhelmed, trying to manage chronic conditions, looking at maybe it's transportation or other social drivers of health that they're grappling with, and that can lead to a lack of adherence. And when you've got a lack of adherence, now you've got a gap in care. And the health plan wants to close that gap in care. So how do you move the member from a state of lack of adherence to adherence? And that's really about trying to overcome these barriers that the member is facing in terms of how do you, simplify things, streamline things. How do you remove a barrier from a social driver of health that's really going to help a member be able to manage their chronic conditions? So digital health solutions are able to address each of these challenges in a way that really helps members be empowered and giving them the tools they need to manage their chronic conditions. And so if we line up each of the challenges that we've talked to for some of the benefits and features of a digital health solution, you'll see that digital health is really well positioned for this chronic condition management. We're looking at, using remote patient monitoring or virtual care visits to help reduce the expense of chronic condition management. Looking at using a digital platform to connect members with their doctor or with push notifications or an online tracking system to overcome some of those communication challenges that health plans face. Looking at trust, again, connecting members with who they want to talk to about their health. They want to talk to their providers. Digital solutions enable that connection point so that the health plan doesn't have to play the middleman there. Speaking of playing the middleman, same thing with care coordination, right? We can remove health plans from the care coordination equation by giving members the tools that they need in order to have those conversations with their care team, giving them the data that they have in an easily accessible manner. So you can go into your appointments and say, look, this is happening. I had trouble sleeping on these nights and these were the conditions. and what can we do to help manage that, that issue. Looking at gaps in care and adherence to care, again, I look at these similarly. In gaps in care, oh, it looks like, there we go. When we're looking at closing gaps in care, we're looking at more flexible options. We're looking at, overcoming some of those barriers. Again, could be social drivers of health. It could be just busy schedules. It could be just being overwhelmed with how much goes into managing a chronic condition. And then we're looking at adherence. There are a lot of different features that digital solutions have that can help with adherence. Again, notifications, reminders, help with scheduling, just trying to reduce the enormity of what can be trying to manage a chronic condition. And so as we're looking at digital solutions really being one of the really great ways to help members manage chronic conditions, we've seen a lot of digital solutions pop up in the healthcare landscape over the past couple of years. Part of this was accelerated due to the pandemic, but we were really down this road before. And I think having Dr. Vedar with us 30 years in digital health shows that this is not a pandemic-driven trend. We've been going down this path for a while. And what we're seeing happen now is this transition from solutions that are focused on one chronic condition to solutions that are focused on multiple chronic conditions. And again, I go back to, you've got that 40% of US adults who have 2 or more chronic conditions, and being able to streamline their care for their different conditions into one solution really helps with the adherence and the gaps in care, coordination of care, and really allowing that one solution to address the whole person health rather than address individual conditions. And so we've got a landscape of health solutions that are focused on multiple conditions. Don't try and write everything down on the screen. I know this is really busy. Reach out to us afterwards. We'll send you this deck so that you can sit with this and really appreciate how much change has happened from addressing one condition to multiple conditions. And so you'll see on here, we've got companies who show up multiple times under different conditions. WellDoc, for example, they support support treatment in heart disease, diabetes, and mental health. And you'll see that playing out over and over again on this slide. Same solution addressing multiple conditions. And how this came about is we really saw 2 pathways to treating multiple conditions. One is a digital health company that started out addressing one chronic condition, right? So we've got a couple of examples. You've got Dario here, who started out focusing on diabetes and then added and behavioral health via acquisition. We've got ShareCare, started out as a health question and answer platform, and they expanded internally to multiple platforms to support multiple chronic conditions. And then on the other side of it, you've got solutions that were built and designed from the outset to manage multiple chronic conditions. We have Julie as an example, which Bettina is going to talk through a little bit more in just a moment, where they're treating multiple conditions. They're focusing, as she mentioned, on the triggers and environmental factors, and really looking at several different conditions, respiratory, pain, multiple behavioral health conditions. And then we look at Vita as another example. So they're really focusing on continuous care and joining the mind and body care process and really looking, again, whole person health. So with that, I really am excited to turn it over to Bettina as we see Julie being one of the leaders in these multiple chronic condition solutions that really started with focusing on multiple conditions from the outset. So Bettina, over to you.
Thank you so much, Ashley. I really, really appreciate the opportunity to present what we've built at Julie. When we met, we instantly hit it off because I think everything that you were saying, all the different issues that are out there, that's what Julie was built around to address, to really engage the patients in their own care, members in their own care. And one of the key things is that we built a platform that was started out for multiple conditions because so many people have several and so many things overlap there. If you look at let's say, I'll call them legacy solutions, you kind of bolt on a new condition, a new kind of way of, creating an additional plan for somebody that has unfortunately gotten a new condition. That's really not useful because it just overwhelms patients and members a lot. What we do is we put that all together into a really focused solution that engages people in a very short daily way. If you could go on to the next slide here. We started out as most startups saying, okay, we believe we have a solution for this, but what we decided to do is to very quickly stress test this. We're a 3-year-old company, but we've already completed 2 rigorous randomized controlled trials, one in depression and one in asthma. People on Julie can have both at the same time, or they can have COPD and bipolar disorder at the same time. But what we showed here with over 500 participants is that we can actually make a difference over just 8 weeks. We can lower the PHQ-8, which is a depression scale, or the ACT, the asthma control test, and we did that together with University College London. If you could go to the next slide. So how does that work? How do we make things work for the members that use Julie? Well, we bring in all these different types of data. So everything from your smartphone, from wearables and connected devices, environmental data. So let's say pollen count. We pull in 26 different types of pollen. Pull in humidity. We pull in sunlight hours, air pollution. We also can pull in electronic health record data from patient portals, and we tie it all together with self-reported data in a very member-centric app. If you could go to the next slide, you'll see a little bit of Julie. There's a dashboard where you can actually see your data. You can see how things correlate. Let's say 2 days ago, I slept very poorly, so today my blood pressure reading is just not as it should be, or my bipolar disorder is getting out of control. You chat with Julie. It takes you less than 90 seconds, or let's say our average user is in and out in 90 seconds a day, which is on purpose. We don't want people to feel like they're sick. We just want people to be a little bit aware. We have a journal in there, and we also have gamified elements, which makes it fun for people to engage, and it's all really about whole person health and engaging people in their own care journey, which lowers costs. Simply said, not only makes people more healthy, as our trials do, but it also lowers costs for everybody involved. Thank you. I appreciate that.
Thank you so much for sharing that overview. I think that's really great. I use Julie myself. I have asthma, and I love that you bring in the environmental data, because then I tell my son, maybe we're not going to the park today. The pollen count is a little high, and we're going to stay home and do something else. So I appreciate that on a personal level. So we're going to open it up now, and we're going to have a discussion with our experts.
Pass that on to my team. Thank you.
Yes. So we're going to have a discussion with our experts now. So I have a couple of questions that I've prepared. I'm going to address them to Dr. Kvedar and Bettina. We'll start with one for you, Dr. Kvedar. What are some of the top pain points that members or patients experience when they're looking to use a digital solution for their chronic condition management?
Well, thank you, and thanks for having me. And I've already learned a tremendous amount listening to both of you, so it's well worth my time. To your point, I think a couple things. One is people don't tend to want to be reminded that they're sick, and we don't, I think, integrate these things well enough into their day-to-day life. So that's a challenge. I think Bettina's team has done a nice job with that, and I think also. It sometimes many of the apps that are out there feel a little bit too clinical. They feel a little bit too like they're talking down to the individual. I think they're designed by maybe clinicians who are used to doing that. But to really engage people around something that follows you around day to day, all day long, you really have to, I think, meet them at a point where they can integrate something easily into their life, and that the what you ask them to do to improve their health is not such a mountain to climb. So it's incremental. Maybe you throw in a little bit of gamification or other ways to engage people and make them feel like it's almost a fun part of their life.
Great, thank you. Bettina, I'm going to direct this next question to you. When we're thinking about health plans, what are health plans looking for as they're looking to adopt a digital solution for chronic condition management?
Well, I think the ones really forward-thinking ones look at the list that you presented earlier and say, okay, what can we find out there that helps us mitigate these things that we have, like the lack of trust and the gaps in care and the coordination and all of those things. So I think that is step one. The other is the evidence-based data. I'm sure that Joe maybe could also talk a little bit about the lack of evidence-based data because so few trials are being really conducted. Your slide showed an explosion of solutions, and that's great. I mean, that's wonderful that there's so much creativity and technical expertise coming into the market, but that makes it really noisy for everybody. And who's the winner? Like, who do we pick? So that's certainly something, and that's where we, are very fortunate that our trials worked. It could have come out differently, right? It could have not. Actually, I was called very gutsy to do that at the beginning of the start of our company. That we had actually right after we launched the product, launched a trial. So that's one thing. Then there's also support needed for example, for member activation. That is a process that not everybody has down pat, because you can have a nice, wonderful app, you can have this great digital health solution, but if nobody uses it, then, what are you going to do? Engagement has to be measured and worked on constantly, and it's not just throwing it over the fence, right? It's so easy to think. As a technologist, often you're like, everybody's going to love my solution and they're going to use it, and it's just going to be wonderful. But in my 2 decades of practice as an entrepreneur, I see how much it takes to really keep going at that and keep engaging the users. So that's really important. And then also the whole silos, right? There's lots of data here, lots of data there. There's individual point solutions. That needs to be consolidated. There's just not enough capacity, human capacity, for integrating all these solutions, pushing them all out. So there will be a consolidation that's coming, and we're already seeing that in evaluations.
Yeah, absolutely. Dr. Glader, I wonder if you can respond to Bettina's point about clinical outcomes and clinical trials. how important is that in putting out a digital solution out into the universe?
Well, it's one of my favorite topics, so I promise I won't take up the rest of the session, but I probably could. I have a whole talk prepared on this, so I'll try to be succinct. We make mistakes. First of all, we as human beings who think about correlations make mistakes, and we often will, particularly I think entrepreneurs. So entrepreneurs are under stress to do magical things for, et cetera. That's just the way it is when you take other people's money. On the other hand, a couple things. I think one is these are people's lives that are at stake. We're talking about not just whether I like one A/B testing in Facebook or a different one. It's about someone's health. And the second is you're pitching these solutions, and Bettina knows this well, to clinicians who have training in science and want to see science. So there's a market reason, there's a sort of a greater good reason. And what it boils down to is that if you just say, well, let's take 50 people and show them any app, and it worked, that's not really going to be helpful, particularly for people who understand science, for all kinds of reasons that I won't digress on. So one of the things I love about working with Bettina and her team is they have done not just quality, but really high quality science for their stuff. And she's right. I was one of the people that said, it's research. It might not turn out the way you want it to, but it did. And so we're all happy to learn that our instinct about whether this tool should prove valuable for healthcare turned out to be accurate. But we can say now with confidence that it's accurate because we did high quality clinical research, or they did. I simply cheerlead from the side.
And I do want to
tell me how gutsy it was until we were done and it had worked, because I think for fear of discouraging what we were doing. But yeah, I think one of the things that maybe, I don't know if the audience knows about this, but I learned that there's a thing that's called active control. I hadn't done a clinical trial before. I have people on my team that have and that are experts, but I hadn't. And that means we had a dummy app, essentially, which was a pared down version of Julie that we used. And I thought that was normal. And then at the end, well, I learned our protocol had been published, it went through the IRB, et cetera, and so forth. I learned that a lot of digital health solutions do the test against nothing, right? So doing something and doing nothing, the outcome of that is, that's I don't know if you can say that in better words than I can, but it's not as valid seemingly.
Well, just very quickly,
have a much more rigorous approach.
Suck up the rest of the time, but I will say one more thing, which is we often think about this context of testing molecules. So Ashley, I could give you the real pill and Bettina could get the placebo, and they would look the same, and none of us would know because we do it, that's the way we do it. That's a pure trial. It's really hard to do that with a digital intervention. You have to compare it to something. Some people do nothing, some people do usual care. But the idea that Bettina's team created what I would consider a digital placebo, again, far ahead of the pack in terms of the quality of that work.
And I do want to add on, just back to the original question of what health plans are looking for. So in my work with both digital solutions and health plans, I hear a lot about really making sure that the digital solution is aligned to their member population, not just patients in general, but their specific member population. So you really want to make sure that you're doing your homework, and just like you would in making sure that you have great representation in a clinical trial, you want to make sure that your data matches the membership population of the health plan that you're working to partner with. And health plans really want to make sure that this is going to be something that's going to impact their membership base, their cost of care, and not just something that generally is going to work well for patients who experience these types of symptoms or have this condition. So I think another thing that I've seen digital solutions do really well is to really hone in on specific member populations for when they're having conversations with a health plan.
Yes.
All right. So talking about patient engagement, right? We know that the app is only going to work if patients are going to use it, right? So how do you mitigate or plan for patient engagement so that you can really make sure that you're able to have that impact on the clinical outcomes? And I'll start, Dr. Kvedar, with you.
Yeah, this is another tricky one. So right now I'm a fairly new, I think, of a 162-day streak on Duolingo learning a language. So to me, that's an interesting comparator because they pull out every single known engagement tool to keep you engaged and keep your streak and put you on the leaderboard. And what I think is interesting is about 3/4 of them mean nothing to me. I'm self-motivated. I want to learn a language, and it happens to be nice that I can do it in 3 minutes a day. But there, I'm sure, are people out there who see that they're falling down on the leaderboard and go in and do more sessions, and right. So these are all tools that are at disposal of people like Bettina and her team when they think about engaging people. I think what's a little different about health, and I alluded to this before, is it has to be fun, but if it's too fun, then it seems like you're trivializing their health problem. So there's a balance between, and it's a tough balance to follow. But it certainly can't be like a clinician talking down to you, and it can't be as flippant as Duolingo. There's somewhere in between those two that's engaging for a health app, and when you get it right, it really works well. I've seen so many, and I'm privileged to see a lot of companies, and I advise a handful at any given time, but I've seen so many people that miss that mark because I don't know if it's because they come from, again, the world of A/B testing is really easy. You throw a couple things up and then you move on. And it isn't, unfortunately, it isn't that simple when it comes to the nuances of someone having an illness, and you're sort of, it's very intimate, their health, and you have to sort of strike a balance on that. That's my view anyway.
Yeah, Bettina, so you mentioned that your team had a couple of different considerations when you're looking at patient engagement, right? You wanted it to be a couple times a day, you had some gamification in there. What made you want to focus on a really good member engagement experience? Why was that important for Julie?
Because it otherwise doesn't work if you don't engage with it. So actually we aim for only once a day.
Okay.
And you can engage actually by tapping something on your watch or doing it on your phone. It can be really easy. Some people spend a lot more time there, but we decided to pull a couple of registers, right? We looked at things where the science already says it works. Simple thing, but very powerful for a lot of people, journaling. There's a lot of evidence in many conditions that journaling helps, and oftentimes it's required in sort of the course of care with a physician where they ask you to, have a sleep journal or have a food journal or all of those different types of things. So we made a journal. It's a simple part, but it's something where there's a lot of clinical evidence that it works. We have the part where we visually show people correlations between things, because if you're someone that has a chronic illness and you're willing to use something like Julie, you are on a journey, right? You are trying to figure out how to get better, and it's a quest that goes on because it's a chronic condition. It's likely not going to go away, otherwise it wouldn't be chronic. And so you want to see how you progress over time. And the cool thing about that is that Julie gets more valuable the more you put into it, because you see more of your data and you see your patterns. So that in itself is an engagement tool. And then we have something that is also well known that you can change behavior, but you have to do micro behavioral changes. So we give people a gamified part of the solution, which is called Daily Dares, and essentially you collect some points if you do certain things, like, you know, eat a red vegetable today or something, or even something as simple as if you have depression, like brush your teeth or make your bed, right? It depends on the condition. And you get points for that. And that gives you this little, you know, dopamine kick. And once you get 5 points, and there's an animation, and they're cute, you know, and you can get badges, etc. And about a third of our users really like that. I'm not that the gamified person. I do like demoing when the animations come up, but otherwise I don't. So we've put these things into a kind of pick and choose model where you don't have to do everything. Julie is there for you. Julie is like a companion. What we're also starting to integrate in our chat are GPT solutions, so AI-based solutions, which tell you there's an exhibition going on near your house. Do you, you could walk over there. It's a 10-minute walk, and you could go to that exhibition. Things like that, because we do know where you are, and we can suggest those things. What we also do is we personalize it, because we pull in your data, and then we can predict whether you're going to be doing worse. And if you do, we give you recommendations in a very light fashion, saying, hey, maybe a little bit more movement, or, you know, it looks like you didn't sleep as well. Why don't you do this? So we're pulling out a lot of stops without making it complicated, right? It has to seem super light, and all of that behavioral modification, et cetera, magic is going on in the background.
Right. I want to close out our formal discussion before we go to Q&A with a question for Dr. Kvedar. Where do you see the future of digital solutions for chronic condition management going?
Well, you've seen some of it here today, and I know I said I am an advisor to Bettina's team, and that is a conflict, but I really do sincerely mean what they're doing is a glimpse of where we're going. It includes that personalization that she talked about. That's really important. The sort of, you have to interact with us once a day. Again, it fits in with their life. There's a little bit of competition aspect to it. And I think more importantly, it's been shown to work. We have all kinds of data feeds now coming in from all over the place, and the next generation of solutions is going to capture all those. There's a term of art that's new to healthcare but not new in other industries called digital twin. I'm sure you all and your listeners, or viewers rather, have heard of that we can now capture enough data about you to create a digital version of you, and we can use that to predict your future. And then respond to it and say, if you keep going in this direction, X, Y, and Z, good things will happen to you, and maybe these are some risks. And let us help you mitigate those risks. That's right around the corner. That's a combination of AI, all these data streams, wearables, et cetera, kind of coming together to help you be a healthier person. And I think the key, again, is that, I'll say it just one more time, is that we don't want to beat you into being a healthier person. We want you to be motivated to do that. And that's where the personalization and the little nudges and things come into the picture and are so powerful.
Great. Well, thank you both for this great illuminating discussion. I'm going to open it up now to discussion for our attendees. So if you have a question, please feel free to pop it in the chat. So let's see. First question here. How can treating physicians or HCPs benefit from the insights from Julie and their specific patients? Tina, that sounds like one for you.
That's that. Thank you for that question, whoever said it. Actually, what we do, and I didn't show this in my slides, is that we actually can integrate into EHR systems. We're a FHIR-based solution, so we can seamlessly integrate into Cerner or into Epic, and what we then do is we can push Julie's data, and we have a dashboard that healthcare providers can look at to see who in their population is doing well, who is not doing well, and where somebody maybe on the teetering a little bit. So there's really sort of a population management dashboard that's available on the healthcare provider side, if that's a little much, also we had just have built in Julie that healthcare providers can get a PDF. And so sometimes if it's not, integrated where a person is, patients often just go and show it to their healthcare providers, but we have it built in even with, being able to drill down, but also getting a very short summary of how a patient is doing before an encounter.
Great, thank you. So the next question actually builds on this. We've got some great synergy here. So Dr. Kvader, I'm going to ask you from an industry perspective, how often do you see digital solutions being compatible with medical records? And what value do you see in this compatibility?
Well, there's some parts of that are very easy, which is I can tell you as a clinician myself, when you're in the environment where you're dealing with patient data and seeing patients, you want one application. You don't really want to be screen switching. We could digress and talk about burnout and the tyranny of EMRs, but suffice to say that that's enough already the way it is. So if I can't get it in the context of the patient that I'm caring for, I may or may not be able to drop what I'm doing, go to a different site, harvest some learning or information. And the flip side of that also, or I guess corollary is a better term, is in having physicians have a pact with the patient around these chronic conditions that says what you do outside of this office is more valuable to your care than what you do when you're in front of me. So that's why these digital tools are so important. Sadly, not every clinician has that viewpoint. And so in order to, it's a little bit like what I said, would make it easy for our members and patients to consume these things. It's really about making it easy for the clinician. The other half of your question, which was how often do I see it? Most people that are out there will say they can integrate, and they can. Not as many have had the experience of doing an integration and being able to show how it works, because it's just, and that's really mostly because we're still fairly early days on a lot of these solutions.
Okay, great. One more question before we adjourn for the day. So Dr. Kvader, I'm gonna field this one to you as well. What makes for a successful digital health solution at a broad level? What are the success criteria?
Yeah, well, we've talked a lot about them. So engagement is huge. We talked about that. Relevance to the consumer, patient, member, however you like to frame that, but the person who's actually, and that's again a different thing about the power of digital in the world of healthcare delivery, which is it isn't about me telling you, my patient, what to do. It's about you engaging in your own health improvement. So it has to be compelling from that perspective, engaging. It should be reliable. It should affect outcomes. As we discussed all these things. So the clinical research is not just me waving my flag as an academic. It's important for Julie to succeed in the marketplace, that they can be confident that their stuff influences health outcomes in a positive way, and say that with their head held high. So those are just a few, I think, and no particular order either. And then there's all the business stuff, which I'm not expert on. That's where, Bettina has leagues of experience beyond me, but you have to get that part right too. It's a little bit like saying, I got everything right, but I couldn't raise money, or I got everything right, but I ran out of money. All those things are important.
Great. Well, thank you so much to both of you for joining me today. If you asked a question and we didn't get to it, we will reply back to you later. We will also be sending out a recording of the webinar so you can review at a later time. If you have any other questions or would like to see a copy of the presentation, please feel free to reach out. I've put up our contact information on the screen. I would be happy to discuss any additional questions, chat through challenges or opportunities that you may have in the digital solution space for chronic conditions. We thank you all very much for your time today. Special thanks to Bettina and Dr. Kvedar, and I hope everyone has a great day.